Joint Camp's a program that we developed about, gosh, it's been 7 or 8 years ago now at St. Francis. It initially started at the downtown hospital. In 2007, it moved to the Eastside Hospital. And the concept behind the program is to get people prepared, essentially, optimize them for elective hip and knee replacement surgery. Everybody who is going to get an elective hip or knee replacement surgery in our system should go through Joint Camp, at least the first time they go through. So we see a lot of people who've had one knee replacement done, and if it's been done within recent memory, we may not have them go through the complete educational process, but they still have to go to the medical and pre-operative process there. If it's been any length of time and there's been any significant change, we'll suggest they go through it again. But for the first timers, it's so critical in their outcomes of doing well. I mean, we can give you the best operation in the world, but if you're ill prepared for what you're going to go through in terms of recovery or how you're going to participate in recovery, you don't know where you're going to go when after your third day here in the hospital and it's time to leave here. We're just going to have trouble. It just answers so many questions for patients. In the Joint Camp program, the first day you're working with a therapist one-on-one. That's in your room. You're not really getting out of the room very much, partly because you've got IVs and things are still kind of there, the unfortunate necessities of being in the hospital. Day 2, you're going to participate in a group situation with other people who are at the same point you are post-operatively. So because of the volume that we do here, there tends to be somewhere between 5 to 10 patients per day getting, sometimes 12 patients a day getting this type of surgery here. So they're all going to participate together unless there's special circumstances, so they can see what other people are doing. I mean, I like the group therapy because it's social. People can talk and see and compare notes, and people can kind of see how they're coming compared to their peers, and they can see that, hey, I'm not the only one having this trouble. But also they can say, as they're kind of getting discouraged, they'll pick each other up. So the group aspect of it is really good for patients, and I think it's very encouraging more than anything else. We see patients doing much better when they've gone through a program like this. We've been doing this for a long time, and we recommend the things we recommend to patients because we think it's going to help them have a better experience. They're going to be at a better outcome. And I think sometimes folks want to tell us how to reinvent the wheel, and we do listen, and we try to optimize our situation for them. But the fact of the matter is that we've done this so much, and our staff, the therapists, the nurses, the rehab people, the case managers, all the folks involved are really invested and really care about making people's experience the best it can be and helping people do well. And so I think if you don't take advantage of this environment, you're selling yourself short in terms of your outcome.